Coming to you live from the NowMedia newsroom.
I'm Jim Check. You're watching NowMedia. With me, Sylvia Weir, the CEO and President of BC Interior Health. Thank you for joining me this morning, Sylvia.
You're welcome. It's good to be with you.
Thank you for lots of stuff going on, and a lot of people in British Columbia, especially in Interior here, are a little bit worried about what's going on. We see these. I think it started here in Kelowna with the pediatrics when we had the services suspended, which ended up putting you into place, replacing the former CEO. And then we've just seen recently, we've seen a mass resignation of all the OBGYNs in Kamloops. And then again in Vernon, we've seen that with the psychiatric doctors. And then that letter just recently from those doctors signing that letter. I think that was 128 doctors and professional staff signing that letter. Where do you think the problem is? Because everybody seems to cite either toxic workplace, communication breaks down. Where is the issue, and what are you doing to change this?
Thanks, Jim. Healthcare is a really exciting and dynamic place to be, and has been for a long time, but it is also a place that is challenged right now. I think the factors that have played into where we are complex, but I'll try to just share some of where I think we are and where I believe that we need to go. Workload is one of the primary drivers, I think, for these changes and these concerns. I have sat down with the obstetricians and gynecologists in Kamloops. I was aware of the issues around pediatrics in Kelowna, and the medical staff are challenged for sure. We have shortages amongst physicians. We have shortages in specialist nursing staff and across a lot of nursing disciplines. So through COVID and since COVID settled, we have seen shortages for sure. We remain, though, I have all of the staff that I have met and the physicians really dedicated to doing everything they can to provide the kind of care that they would want for their loved ones. So I would say that workload, there are compensation discussions going on between physicians and government. That's not an area that the health authority has any jurisdiction over. But really, I think it's about changes to the way people are working, changes to the way they want to work. People want work-life balance, and I absolutely respect that. And different groups have made different decisions when faced with those challenges. I do believe that there are cultural issues. I have worked throughout my career with relationship and collaboration as a priority, and I believe that we need to leverage those skills. The whole of the senior executive team is committed to moving forward with transparency and collaboration in seeking to rebuild trust and a positive culture across all of our sites. There are many teams and sites that are there now, but there are teams and sites that are suffering that I think really need our support as healthcare leaders, the ministry's support and the community's support. There's a lot of great people that work every day, and then they come home and they see negative stories around services, and it's really hard. It's really hard to manage through for them. But equally, I think, and I understand patient anxiety and concern about stability of services. So we need to focus on service stability, which is where I am right now, but we need to build out for the future. We don't want to see this repeated.
Communication's been cited, and this goes back a couple of years ago too. Communication's been cited by I think 6 Okanagan mayors sent a letter in, said that there's lack of communication from Interior Health. And I know you guys have a large communication department, and even for ourselves, it's very hard to get communication. I do thank you for doing this interview, but it was after multiple reach outs, and I hope this is going to change, because accountability and transparency is one thing that you can do more of. And you have a pretty big communications department. Why is there not more communication?
I think that the system is, or maybe I shouldn't call it a system because it's people. There is an awful lot to do, and our priority is to provide services. But my priority as a CEO, I think, is to signal the transparency and collaboration which I expect. So that requires a lot of time to partner with communities and with community leaders. So the last 2 days I have met lots of external partners. And over the last 2 or 3 months, I've been out meeting sites and meeting mayors. I've contacted almost all of the mayors in all of the communities that we work in. So the commitment is there, and it is there throughout my senior executive team. We need to be out there talking. I want to be talking about the great things that we're doing, because there are some really great new initiatives that we're looking at together to try to take the pressure off clinical staff and off medical staff. So that commitment is there to collaboration, and you're right, that this is an example of it. We're going to be talking about what's working. We're going to be honest about what's not working. I don't want patients to be anxious, but I think that we all need information. So we need to understand the reality, and then we need to understand what we are working on to improve things for the future.
I guess the bigger question that I've been asked to ask is part of the problem above you? Is the part of the problem below you? Where is the disconnect? Because if we have 128 doctors, this isn't the only letter. We also seen this with pediatrics. When they're signing these mass letters, there's obviously just like a sheer amount of frustration that they're exhibiting, and that must mean there's a communication breakdown. Like when we talked about pediatrics, they talked about a toxic work environment. Are you guys attending the same meetings? Like how is there such a big disconnect from what IH is saying and what the doctors and the nurses themselves are saying?
So I think the letter that you're speaking of is a provincial issue. So the obstetrics and gynecology challenges, they are very real, and they are very real across the province. So my jurisdiction is local, and I can only speak to what we have done over the last few months together and what we intend to do. So the challenges may still be there, but with communication and with transparency, we can be more honest about those challenges and talk together about how to fix them, rather than sitting in corners and worrying about them on our own. So I can't speak about the past. I can really only speak about the now and about the future. And communication and relationship will be core to everything that we do. And I am absolutely listening and talking to physicians, and I hope that they will find the collaboration and the solutions sufficient, such that their frustration won't boil over and won't move to some of the decisions that groups have made to date.
And I applaud you for taking this interview, because we couldn't get an interview with the former CEO, and that's part of the thing, is just being able to communicate. And I believe that that's a great first step. But you were also part of the team that was in place when all these frustrations were there too. You were the CFO, which is a lot of people would say is second in command. Do you think you're far enough removed from it to change course and to chart a new course?
I think the proof of the pudding will be in the eating, Jim. So yes, I was part of the senior executive team. I had a very different role and a very different level of influence over some of these parts of the system. I have, in my whole career, prided myself and been very focused on relationship. This is such a complex system. We are across so many communities here with so many different types of experts that we can't do it on our own. We have to do it together. So I think I have demonstrated in all of the work that I have done is that is the way that I work. And that is the way I have the commitment of the whole team to operate that way. So I believe that things will improve, but as I say, we will have our challenges. So you can communicate, absolutely, but we will still have shortages that we need to deal with. So we need to be creative as well. We need lots of kinds of expertise at the table, and we need physicians at the table. So part of the changes that I've made in the senior team is to support the medical leadership structure, to install specific medical roles for supporting physicians through issues that they face, and engaging more. So engagement will be a top priority for me, because together we can do a lot more than than apart.
What's the one thing or a couple things that you need to start solving these problems? Is it really about money? Is that one of the biggest things, or is it about just the changing the work balance of how these physicians operate?
I think compensation, absolutely, it's important. It's important for people to sustain their lives and their families. But what I have heard and what I see is people haven't come into this for money. They've come into these roles because they believe in and have expertise in providing patient care. So for me, it is my priorities are addressing workload pressures. Because they're real, and we need to be full on recruitment and retention of medical staff, and we need to bring in other kinds of medical staff that haven't had the same profile and haven't had the same numbers, and we're doing that. And then we need to be talking honestly around culture and how we build trust, and communication, I think, and transparency are foundational components of that we are communicating right now.
And how is your communication with the Minister of Health, Josie Osborne? Is that pretty good? Are you getting what you need, or is that kind of a battle as well to get what you need here in the interior?
I think that everybody in the community will understand that there are pressures at a provincial level. There are significant financial pressures in BC that the government needs to grapple with. But I have found the Deputy Minister and the Minister very supportive, very responsive, and very open to conversation. So I have had very many meetings with the Deputy Minister. I've met with the Minister specifically around obstetrics and gynecology. So I believe that the Ministry is all in on trying to support us to move forward in a really positive way.
Are you making headway with the pediatrics, the pediatricians here in Kelowna, the OBGYNs in Kamloops and in Vernon with that? Are you making some headway? Are you having meetings that are a bit productive? Are you going to be able to convince them to come back to the hospitals?
Well, I think that the issues are different in different communities, and so we're addressing them all, but they're not necessarily the same thing. I am confident that the pediatric service has a really strong foundation. We are moving through planning with the pediatricians. And we have new pediatricians on board in Kelowna. In Vernon, the psychiatrists have done a fabulous job. The changes in psychiatry there are unlike Kamloops in that it wasn't that the department had made a decision together. There have been changes in Vernon that are separate. Many of them are personal decisions, but we are absolutely communicating with them and focusing on psychiatry recruitment. And then in Kamloops, I am continuing. It is the top priority, service stability for mothers right now. Talking to the obstetricians, looking at all of the issues that we have control over, looking to influence those issues that we don't have control over, and hoping very much that we will see in the next weeks a stabilization and then a collaborative, sustainable plan for the future.
These bigger issues really brought attention to the interior health from more of a British Columbia stage there with pediatrics, OBGYNs, and the psychiatrists in Vernon. But this ongoing issue, which has been going on for a couple of years now in interior health, and that's the ER closures. Where do they start to see some relief when we're telling people that they need to drive 2-3 hours over a winter pass to get emergency care? When will they see some results?
So we have absolutely improved our ability to keep emergency departments open. We have been doing everything we can right up to the last day. We have dedicated resources anytime that there is a sick call that comes in. People are on it looking for nursing coverage, looking for physician coverage, and we have had success with that very focused approach. But I think that we all, as communities and as a province, need to be realistic around supporting and sustaining emergency services rurally. And so the virtual ED project that we are launching now, I think is a way to address that in a really positive way. So we have spoken to physicians about that, to municipal leaders, and that involves protecting physician time. In rural communities, there are physicians that seem to have no life outside work. They're always either on shift or people are calling them to come in. So the virtual ED, where there is provision overnight from a physician from a different community, is one of the kinds of strategies that we're using to sustain services into the long term. So trying to be creative, not just keeping on with the same strategies, but looking at other ways to ensure healthcare access for the future.
Do you have some success markers for you and your team? Do you have some goals that you've set right now to say, like, we need to hit this by 6 months, a year to get some of these doctors back in working? Like, what are the success markers for you?
Well, we are influencing the compensation conversations. I think we need compensation settled. We have recruitment targets for physicians, and we have focus areas for physicians. So right now we are focused on obstetrics and gynecology, on psychiatry, on hospitalists. So we have recruitment targets for physicians. We also are rolling out more nursing staff through an initiative called the minimum nurse-patient ratio. So we have targets for how many units we have to have increased our nursing in across the province. And then from my perspective, we have engagement. We have engagement targets. So ensuring that the community knows us, sees us, knows who we are, hears from us. I want to be able to be seen at sites and enable people, staff, and community leaders to be able to express their ideas and their concerns. So we have lots of obligations that I have placed and that we have embraced as a senior team. And then around recruitment and retention, which is really important, looking at this virtual ED model, seeing whether physicians are happy with it, whether patients are happy with it, and then leveraging every and all other health technology that we can to return physician and clinical staff time to patients, to automate processes where we can, to look at the health technology opportunities for patient-facing, like robotics. So we have lots of opportunities that we are pursuing within the next year to turn this around. But I think if I wanted to say what was the most important thing to me, it is to rebuild the culture in the sites that have felt the pressure, so that people want to come to work with us. People want to stay working with us, and communities have confidence in our services. That's what I want.
I think my last question here, and I do thank you for your time. According to the Fraser Institute, we rank about third in spending in 31 countries, but we rank really low in outcomes, right? So do you think there's too big of an administrative beast? Where's that money being eaten? Why is more of it not going into patient outcomes as opposed to, like, how are we spending more and not delivering more?
So the financial picture is a lot bigger than interior health. So there's funding related to physician compensation that the ministry has, related to pharmacare around drugs, and then there is money that goes into clinical care and money that goes into administration. We're actually the lowest percentage cost for administration across BC. I don't know what it's like across Canada, but our focus and our money is in clinical care within interior health, where it should be. I think what we do need to look at, as will all the health authorities do, is where we can save, where we can become more efficient while maintaining and strengthening frontline care. So that's our challenge for the future.
You alluded to technologies. Are you putting into place some of the AI technologies that are in place right now so that you can have more doctor-patient time as opposed to, like, administrative paperwork and that?
Absolutely, and that's what we're excited about. So those conversations need to engage physicians. I don't want to go off and grab a technology that isn't supported, but I know that we need it to retain our physicians. We need it to recruit physicians and other medical staff. So we do have I have a VP of health technology, and he is charged with bringing back the best and the brightest ideas, and we have partners externally that can help us with that. We have an innovation center, the Jim Pattison Innovation Center, that is supportive of health technology ideas. So I'm really optimistic about the ideas that we can put into practice in the future. But my focus is service stability now, sustainability for the future, and that will absolutely embrace technology.
I do have one last question. Sorry, I have one last question, and it is, there's a lot of recruitment going on, and so there's some focus in the United States. There was some focus in the United Kingdom. I'm not sure if there is still focus there. And then we look at the focus of bringing back the doctors that are here, living here, still serving the community, but not attending the hospital. Where do you put most of your focus? Where do you think you're going to find most of the results? Where is the Sylvia's focus on getting the doctors that are here back in the hospital, recruiting from the U.S. or the U.K.? Where is that?
I think that my listening in the rural areas is that homegrown talent is the talent that stays. So I'm very, very keen to make the conditions such that those that have chosen to work in the community will come back to the hospital. And that is really about the on-call burden. On-call is a significant challenge for a lot of medical staff and have led to them making different decisions. So they are things that we could work on together. Historically, physicians have worked on those scheduling issues themselves. So I would love to see physicians that are in our communities, train in our communities, stay in our communities. But at the same time, I think we need to be realistic with the way people want to work. And so we will need more medical staff in the future. So we're very happy to welcome physicians and other medical staff from the US and internationally. So international staff take a little bit longer to get here because there's a lot of administration around ensuring that they have the qualifications that are the same as Canadian requirements, that they go through immigration. So I would say that we're approaching them all, but I'm really focused for the long term, for the future, on supporting BC young people who choose to go into medical training to stay in BC communities. That's what I would love.
I really do appreciate your time, and I hope we can do this again several times, I hope, because I think communication is important, because there's a lot of people out there worried, especially when they see the negativity, and then, like, people are criticizing. They have a right to criticize right now as well. And, I think, hearing your voice would help people, assure people that there is at least a plan being worked on.
I'm sure I'll talk to you again soon.
All right. Thank you for your time.
Thank you.
And thank you for watching Now Media.
We don't just report the news. We live here too. We're your neighbors, bringing you stories that matter to all of us. No government funding, no outside influence. Kelowna Now, local, independent. News you can trust.